The pharmaceutical giant Eli Lilly is close to launching the strongest weight loss drug ever. And yet, years before it's approved, gym bros are already buying retatrutide on the grey market to shred fat. Retatrutide is a GLP-1 in the same family as Ozempic and Mounjaro. It's unique because it targets 3 hunger hormones: GLP, GIP, and glucagon, whereas the other drugs on the market only target 1 or 2. In theory, that means more staggering weight loss. Eli Lilly hasn't finished clinical trials on retatrutide, and it isn't approved by the US Food and Drug Administration, so doctors can't prescribe it and pharmacies can't sell it. But over the past year, retatrutide has been gaining traction on YouTube, Instagram, TikTok, Reddit, particularly among fitness circles. People trying to cut fat while building muscle are buying powder labeled RET or RETA from online research labs, which are legally allowed to manufacture compounds like this for research only. At home, people mix this powder with water, often using ChatGPT to work out the ratio, and then inject it into their muscles. We spoke to fans of grey market Reta who post eye-popping photos on social media as proof that it works. They claim that the injectable they're taking helps them to shred fat without the muscle wasting that many people experience on Ozempic, Wegovy, Mounjaro, and Zepbound. While there is some evidence that Eli Lilly's retatrutide may have fewer side effects than other GLP-1s, buying an unregulated knockoff has serious risks. There's a risk of contamination and bacterial infection when you're buying a powder from an online research lab that is not subject to regulations. There's also a risk of contaminating the substance yourself when you're mixing it up at home. Plus, tests show that dosing varies widely across these powders, even when they're listed with the same dose. Is this legal? It's complicated. All of these powders are sold with the caveat that they are not for human consumption. Research labs are not legally allowed to sell medication for people to consume, but that does make it hard to regulate. A Brookings report earlier this year found that the majority of counterfeit GLP-1s come from wholesale manufacturers in China, which exist outside of US oversight. Eli Lilly told Business Insider in a statement that anyone purporting to sell retatrutide for human use is breaking the law. The company added, no one should consider taking anything claiming to be retatrutide outside of a Lilly-sponsored clinical trial. Still, the trend persists. Creators make new profiles, labs fly under the radar. It looks like this is not going away. For more on this trend, head to businessinsider.com.